Good afternoon, everybody. Today, my topic for clinical discussion is thrombosis. So, first, thrombosis is the definition of thrombosis is nothing but the formation of blood clots. It might be in your blood vessels or the cardiac vessels as well. So, what does it does? So, because of this clots, they block the blood flow. Either they break down and travel to the other parts, and also get stuck in a very critical regions. For example, in your heart, lungs, vessels or brain vessels, which will lead to the very life-threatening emergency. That is because due to the decrease in the supply of oxygen to the particular region. So coming to the types of thrombosis, there are arterial thrombosis, arterial thrombosis are the one where the thrombus is formed in your arteries. So here, this might be one of the most cause for cardiac arrest. And then coming to the venous thrombosis, here the thrombus are formed in your veins. So this is one of the major cause for pulmonary embolism, and then cause of blockage where it is formed. So usually wherever the thrombus has been formed, certain times it remains in the same place, like it develops, grows and it blocks in the same place. Sometimes it travels from that place to another and blocks the other place as well. Next, coming to the complications, like for example, if it is seen in the brain region, then it is called as transient ischemic attack. If it is in the neck region, nothing but it's a stroke which occurs. If it is in the heart, then you heart attack. If it is in the lungs, it's like pulmonary embolism. And if it is in the abdomen region, that abdomen, so it is called as mesenteric ischemia. Next, coming to the like how commonly it is seen, like in which patients we commonly observe as patients with atrial fibrillation, cancer patients, coronary artery disease patients, diabetes patients, and those who have clotting disorders like antiphospholipid syndrome, and the patients who use tobacco. So these are the people who are more prone towards it. Next, coming to the symptoms. So symptoms basically we categorize based on the size and the location, how much the size is and in what location it is. So first, coming to the lungs. In the lungs, if the thrombus is there, so the patient experience a sharp pain in the chest region, shortness of breath, difficulty in breathing. When coming to the heart, if it is in the heart region, it is a chest pain and discomfort like common, and then trouble in breathing, dizziness. Next, coming to the abdomen region. If it is in abdomen, it causes a severe stomach pain, especially after you consume any food, and then bloating, nausea, vomiting, diarrhea, and fever is seen in the case if the thrombus is present in the abdomen. Then coming to the brain and neck region, where weakness or trouble in controlling any side of the muscle, any one side of the muscle will be seen. Speech alterations will be seen, and lack in the muscle control, and also the numbness of the muscle will be seen. Next, coming to the arteries in the when the thrombus is present in the artery of hands or legs, that time in the artery if it is present, the skin looks pale when compared to the other parts. Along with that, when you touch that region, you feel the skin is cool to touch when compared to the other part, and also necrosis also will be observed. If it is in the veins, it is of the skin color will be darker, not paler, the darker than the other region, and it also you can see a fluid accumulation in that region. The pain will be there, and also when you touch the region, it will not be cool, it will be warm. So next, coming to the etiology. So thrombosis, basically here we can see the three factors, that is endothelial injury, abnormal blood flow, and hypercoagulability. So endothelial injury, it's basically whenever there is an injury in the endothelial region, all these factors get, like the clotting factors get activated. That is the basic mechanism. Like if any wound happens, the clotting factors, the platelet plug is formed, all those things will happen. But here, when there is an endothelial injury, could be because of trauma, either bacteria like staphylococcus, and along with that there are viruses which causes virus, parasite, and tumors that invade the endothelial region. Next, coming to the hypercoagulability. In hypercoagulability, there is an increase in the level of fibrinogen, prothrombin factors like 7A, A, XA, platelets also will be increased, and decrease in antithrombin. So due to which the clot which is formed will not be dissolved, or the formation of the clot will be more. And next is abnormal blood flow. See, abnormal blood flow is when there is a low, like the blood is flowing very slowly, or the stoppage of the blood, the platelets are exposed more to the endothelial region. So this is the reason. This is the reason. One more. This is one of cause of the thrombosis. So this might be seen in the patient with chronic venous congestion, CHF, age factors also matters, and in also the case of varicose veins. Next, coming to the pathogenesis and risk factor. Pathogenesis is whenever there is a damage of endothelial region, the clotting mechanism occurs, and along with that, if there is a reduced blood flow, this is the basic mechanism of the clot which is formed when there is a wound. But in thrombosis case, this clot which is formed, it may be the reason of unnecessarily, or the dissolving of the clot will not be occurred. So that will be the main reason. And apart from that, the risk factors include arteriosclerosis, arterial fibrillation, blood clotting disorders, diabetes mellitus, hypertension, cancer, and tumor. These are some of the risk factors, but for thrombosis there are so many others. Next, coming to the diagnosis and treatment. So diagnosis will be based on the physical examination, imaging tests and blood tests. So physical examination will be based on the symptoms, which region, what symptoms has been observed by the patient, all those. And then next, coming to the imaging testing, that is the MRI, CT, and the ultrasounds will be done. Along with that, the blood test indicates what are his WBC, the platelets counts, along with that prothrombin time and the coagulating factors. The treatments are for this. The first thing is blood thinners are being used, which prevents the clot formation and also get rid of the existing clot. In the blood thinners, we have antiplatelets and anticoagulants. Antiplatelet aspirin, clopidogrel aspirin, for example, 75 to 150 mg once daily. Clopidogrel 75 mg once daily. Icoperidone, and in anticoagulants, heparin, warfarin. Next, coming to the thrombolytic therapy. So in thrombolytic therapy, they use the medicines to dissolve the clots. So for example, in the thrombolytic drugs, there are two types: non-fibrin specific and fibrin specific. So in non-fibrin specific, we have streptokinase, urokinase.